Hi friends, welcome back to my channel. Today we will talk about the biggest and strongest bone in the human body, which is thigh bone or femur. The femur or thigh bone is articulate with two bones and they make two joints. The proximal part of it, which is the head of femur, articulate with the acetabulum, which is a part of pelvic. They make a hip joint. And then the distal part of the femur, they articulate with the tibia and patella. They make a knee joint. So today we will talk about the landmarks and the attachment parts of different muscles on femur. So we have two surfaces. We have anterior surface and we have posterior surface. The anterior surface, also called smooth surface. Why? Because we don't have that much ridge and line and roughening on the anterior part. And this is a point that we can differentiate it with the posterior surface. And we also have posterior surface. So we learn them by dividing them into three parts: proximal, middle, and distal. The proximal part, we have a head of femur, which is look like a ball, which is they make a ball and socket joint with a acetabulum. So the ball, then on the ball, if we look at it in the medial side, we have like a fossa. It's called fovea, which is attachment site for fovea ligament that attach acetabulum pelvic and the femur. So then we come downward, we have a neck. We have anatomical neck of femur. Then we have like a bony prominent, which they are big bony prominents. We have two of them. One on the lateral side, one on the medial side. The lateral part, or the prominent on the lateral side, is bigger than the one in the medial side. The lateral bony prominent, call it greater trochanter, while the other one, smaller one, what we call it lesser trochanter. Why lesser? Because it is smaller in size. On the anterior surface, we have a line between these two trochanter. What do you think the line called? Intertrochanteric line. Why? Because it is inter mean between. If you study terminology, you know that inter means between. So it is the line intertrochanters. It's called intertrochanteric line. On the posterior side, we have a crest between them, not a line. That's why we call this intertrochanteric crest. That's it, right? Then it is proximal part. I think we have that much. Okay. One more thing. When we come downward, just inferior to the trochanters, it's like this. We have a surgical neck of femur. So I think that's it. We have that much thing on the proximal part. Then we come downward. We have a shaft or middle part. On the shaft, on the anterior surface, which is a smooth surface, we don't have, I think we don't have any line or things to talk about. So we talk about the lines on the posterior surface. On the posterior surface, we have two lines that come together and then they attach, then they are detached. Before they attach together, we have medial lip of linea aspera and lateral lip of linea aspera. And then they come together, they attach, call it linea aspera, and the end, which is the distal part we talk about later, they detach. So the medial lip and lateral lip and the linea aspera itself, before they attach together and after they attach together, they are attachment point of different muscles, including adductor muscles and also hamstring muscles. So we have this, and superior to them, we have gluteal tuberosity, which is the insertion point of the gluteus maximus muscle, and on the lateral side, which is just inferior to the greater trochanter, and on the medial side, just inferior to the lesser trochanter, we have pectineal line, which is the attachment point of pectineal muscle. So we have these two. Then inferior to them, we have the medial lip and lateral lip of linea aspera, and then we have linea aspera. I think that's it for the shaft of femur. Then we come more downward, we have distal part. On the distal part, on the posterior surface, we have the detachment, the two detachment line that we talk about. We have medial supracondylar line and lateral supracondylar line. Why this name? Because we have medial condyle and lateral condyle. The line is superior to them, that's why we call it medial supracondylar line and lateral supracondylar line. Okay, we know that. Now then we have condyles that above each medial condyle and lateral condyle, which we call it medial epicondyle and lateral epicondyle, which means above the condyle. So they are the lateral epicondyle and medial epicondyle, they are attachment of collateral ligament. On the medial side, we have a medial collateral ligament attached to it, and lateral one is lateral collateral ligament attached to it. So we have these on the posterior side. One more thing, when these condyles, medial and lateral epicondyle, they look like this, and the medial part of them, call it, because it's a line that attach two condyles together, it is intercondylar line. And if we look at it on the inferior part, we have intercondylar fossa. It's fossa because it's between the condyle, call it intercondyle. So I think that's it on the posterior surface. On the anterior surface, we have two things. We have a patellar surface, which is on the anterior part. It's exactly posterior to the patella, with the place that the patella, which is the sesamoid bone, attached to femur. It's called patellar surface. Easy, right? And then on the medial epicondyle, above the medial epicondyle, we have a tubercle, which is called adductor tubercle. Why adductor tubercle? Because adductor muscle attached to it, the muscles is called adductor magnus. And we can also talk about patella because not that much to talk about. Patella is the biggest sesamoid bone in the human body. So femur is the biggest and strongest bone, and sesamoid bone that's above it, which is patella, is the biggest sesamoid bone in the human body. And patella is a part of the knee joint. With the femur and tibia, they make a knee joint. So I think that's it for today. And if you get benefit from it, don't forget to like, share it with your friends, and subscribe to our channel. Stay safe and see you in the next video.